Hello and good afternoon, everyone, or good evening, or even perhaps good morning, depending on where you're joining us from. Hello, my name's Ekanjali, and I'm going to be your host for this webinar. Thank you for joining us. I'm going to ask my good friend and the producer of this webinar to join me, Jose.
Oh, don't make me come over here.
Well, no, I am going to. So firstly, I'd love you to introduce yourself, Jose, to the audience.
Hi, my name is Jose Garcia. I produce a lot of webinars. I work in health AI, product development, oncology, and produce a lot of video content, educate people about implementation challenges. And I met Ekanjali over a year ago, which is kind of like, this is almost like a bookend, isn't it? I feel like we've come like,
Yeah, it's been about a year of
more than
us
a year.
talking about this area.
Yeah, it was like, what's it called? Challenges in adopting AI into clinical workflows. I would never write a title like that now. But there we were, just focused on integrating AI into a clinical workflow as if that was the only thing that mattered. It was just, back then it was like, is it integrated into a workflow? Is there privacy and security? Is it compliant? And that was it. I mean, in my world, that was it. So I was in product development. That's it. Does it work in the workflow? Are we GDPR compliant? Is it data secure? And that was the whole conversation that I was in. And now it's kind of, people are like, wait a second, other things matter too.
Well, exactly. I think the ecosystem is starting to mature now, and there's lessons that we're learning around how much this impacts workflows. So really, do they need to be redesigned and reimagined? And what is the opportunity there to really look at the patient care journey, streamline it, and bring it towards the future of what we want to be able to achieve. So thanks to you, Jose. We've got three wonderful guests today joining us on the webinar, which I'm really pleased to be able to introduce. So we'll be first joined by Sigrid, who the audience might know well already. She's absolutely wonderful. She's a health AI consultant since 2021. And will be joining us to answer some really interesting questions around how the landscape is changing and why workflows and looking at it from that very targeted workflow lens might not be the absolute way to go about things. Towards the end of the webinar, we'll be joined by Anastasiya. She is the CEO of Boro Oy, joining us from Helsinki, and she consults on global innovation across a range of landscapes with startups to VCs, etc. So we have a global panel here today. I should have said I'm from the UK. We've got Sigrid from the Netherlands, Khalid from California, and Anastasia from Helsinki, and Jose from Valencia. So this is really a global panel for what I hope is a diverse and global audience as well. So together, we'll be able to bring a really rich narrative to the conversation. But that said, your voice is very important as well. So we want to hear your questions. We want to start getting into the nitty-gritty of this topic. And so your views, your questions, your thoughts, please do post them into the chat. We'd love to hear from you and start to get your input on that. And whilst we have already thought about how we'd like to address this topic, we'd certainly be addressing your questions along the way as well. Great. So without further ado, well, you're welcome to stay, Jose, but I'd love to invite Sigrid onto the stage. Hello. Thank you for joining us from the Netherlands. Hello.
Thank you for having me, Ekanjali. I'm good.
Oh,
I'm looking forward to this conversation because I think it's an important conversation to have. I think workflows are important to look at, but I'm looking forward to diving deeper into it as well. with
Yeah.
you and the others.
Yeah. So before we start, Sigrid, do you mind just introducing yourself to the audience as well, and
Yeah.
just sort of your lens to this conversation?
Yeah. So I'm Sigrid. I'm originally Norwegian. So I grew up there, and I already from a young age I knew that I wanted to do something in healthcare. Maybe personal stories, but we can go through that right now. But then I started in healthcare, and I got very frustrated with how everything were just working, how I had to prioritize my patients. And I have a clinical nutrition background, by the way. So I work differently than doctors. I work differently than nurses, and that workflow was also not always known by others. That's one thing. So how you kind of implement, because it's not just one workflow, right? It's like you have different people who are working together with very different like many patients.
Yeah.
And not always the same group would see the same patient either. But one of my frustrations was how we prioritized. I come from one of the countries where healthcare is, I would say, most equal and like accessible to everyone. It doesn't matter if you're rich or poor. If the king comes in, he would just get a normal hospital bed as anyone else. You don't have those differences. And when I worked there, I remember that the hospital, either was a hospital or the prime minister at the time, got hospitalized. And some of my colleagues like, just give him, the worst room, or like just like where the storage room or something. They're like, so they see how things are. So we don't have that hierarchy in the same way as many other countries.
Yeah.
But at the same time, when we got patients, it was not, well, one, it wasn't always clear to me how I prioritized. And then it became more clear the longer I worked there. And it's like, oh, but we in Norway prioritize tasks that will bring us money instead of patients who actually need care.
Yeah.
So I would be there as a nutritionist, give treatments to or talks to patients with osteoporosis. So they need to drink milk. But often when they've come so far, it's you can't just drink milk and eat D vitamins. You have to take supplements, and you have to do more than just that. But then I had to prioritize those instead of having people with malnutrition. So that was frustrating to me. After that, a long story. So after that, I was very frustrated with a lot of things, and I moved to the Netherlands, which I realized is a very innovative nation. Just the culture is more innovative. Norwegians, it's the best country in the world to live in, or whatever you hear. So you kind of get imprinted in your mind, so you don't think about how you can improve things, because it's already perfect, right?
Yeah.
I don't agree with that. But in the Netherlands, it's always like people are never satisfied, which can also be challenging. But what also makes like, okay, we can improve and we can make things different. And I personally love that way of thinking and that mindset, because it brings us forward. And that's kind of where the technology comes in as well. Because I started when I came to the Netherlands. First I studied, and then I started working here. When I worked here, I started with health tech, and I was like, oh, technology can actually help a lot of these challenges that I had. It can't help everything, and technology is also part of the challenges and frustrations I had, but it can help a lot.
Absolutely. So there's a couple of really interesting points that you raised there. So the first point, and is one of the frustrations that I sometimes have when we are workflow based, is if the workflow is flawed. So where a clinician like you is being encouraged, or sort of your hands are tied to prioritize things in a way that perhaps you wouldn't want to. So that the example you use there, where you're having to see one group of patients because that's where payment is directed, versus those malnutrition payments. So that's a really good example of when a workflow can be flawed, and you're actually reiterating that flawed workflow potentially when you're replicating it in exactly the same manner using AI. But that's one of the value adds that I think technology brings, really. It's allowing for more equity in healthcare, potentially, because it's encouraging accessibility as well, if it's designed that way. So, I mean, the other element of what you were saying is you've compared two different workflows, right? So that you experienced in Norway and versus the Netherlands as well. So you've seen two different ecosystems and how healthcare can differ and be applied. So there's a little bit of a global language there as well, global knowledge sharing. So from your perspective, and certainly, you've done clinical work, you've been for several years consulting in health AI. Where do you see the most like common bottlenecks or things where you get where AI implementation and adoption gets stuck when we're particularly looking at it from a workflow angle? So, on the wards, in primary care, where are the bottlenecks around adoption when we look at it from that way?
I think the first part is really understanding what type of problem I'm trying to solve for. And I think that's global, and I think that's okay, maybe not specifically workflow, but is impacted by the workflow. Because if you don't understand the workflow and you don't understand what you actually want to solve, like understand how people are working, you don't know the problem people are having. So I went to a conference last week, and I stood at a stand. It was not my stand. I was just standing there, random stand, and someone comes to me from a Ministry of Health in a country, and they come to me and they're like, "I'm looking for AI. Can I find AI here?" I was like, "Looking for AI." And so, what are you trying to like? What would you like to use AI for? What are your challenges? What are you trying to achieve by AI? No, you're not getting. I want to see AI. And I was just like, we were not speaking the same language. I was like, "Oh, but what do you want this AI to do? What type of AI? There are different types of AI. How, like, where would it be?" It was a health tech conference. Yeah. So it was like health related, and it was also Ministry of Health. But we were really like talking across each other. And I think that was like afterwards, like, yeah, but now you're just trying to implement, like, you're just trying to look for AI and search for AI just to have AI, but you're not really trying to solve anything. You don't know what you're trying to solve. And that was Ministry of Health. And I asked him, okay, so is it for you? Is it for hospitals? Is it like for the healthcare system? How are you like looking at this? But the same comes to workflows as well. Because if I'm just going to implement something because I feel this pressure I need to implement. I feel this need, I need to be on this like flow and this wave of AI and technology and digitization and stuff like this, but you've never asked or like sat down to think about, but what am I trying to solve for? Well, then you already fail, because you need to know what you're trying to solve for, and you need to as well. Okay, so you figure out what you're trying to solve for, but how do you measure that? How do you measure whether or not, like, how can you measure currently how like baseline is? Can you measure how good it is? Are there some measurements you can take? If not, okay, can you make some measurements? Like how can you figure out, if it's improving? If not, is this the right implementation for you? But then also, because workflow is what I just mentioned, like my workflow is very, very different to doctors, to nurses, to any other like physiotherapists, whoever I worked with. And so you need people involved. Like in one workflow, there's so many streams, like a tree. It's not just like one simple workflow. So you need to understand what's linked together, how different professionals interact with each other, or like kind of like the whole patient workflow also goes. So how maybe follow the patient, so how does the patient go through this? Not only from a clinician point of view, but from a patient's point of view.
Absolutely. I think you've really hit the nail on the head there, where, it can feel like a conveyor belt with patients. You first you go and you see this person, then you go and see this person, then you go and see this person. And that's the issue with the workflow. And where what I'm really trying to encourage is how can we reimagine efficiency? So how can we look at technology instead of going, oh, right, I'm going to make this siloed solution for one specific issue, and there's a need for that based on a specific problem. Well, that problem over the next 5 years might completely transform as the way we interact with technology changes as well. So there needs to be a little bit of multidisciplinary, like almost, instead of just one user, one end user, or one specific way of implementing something in a specific workflow. Really coming together as a multidisciplinary technology team that includes clinicians, includes technology experts as well, includes administrative staff, because I feel like a lot of the cognitive healthcare burden is actually administrative. It can be so hard for a patient to access their care or get involved in keeping up to date with their record. And that's not a medical problem or a clinician problem. That's an admin problem. So we really need to come together and go, should patients be doing it like this? Should we really be doing it like this? Or is there another way that we can make this a far better experience, particularly when you're unwell? Have you seen that happen, or do you know?
Oh yeah, I'm just thinking of a story like a lady I had as a patient back then. And well, she came in, and that's what you're saying, like it's like a conveyor belt. So I just see, okay, I'm sitting there in my office and I'm having conversations with those patients, but you don't realize what actually happening with that patient. So I had one patient, and she had diabetes, and she was had eating disorder, and I think anxiety as well. And she was like, she couldn't live at home. Like there were so many things, a complex case. And she came to me because of the diabetes. And it's like, okay, well, you are not diabetes, you know, like you are a person, you have all these things happening in your life. And she needed help with social care. She needed help with, like, she was in contact with the doctor. She was in contact with different people in the hospital system. And I just started, like, I hadn't worked there for a very long time when I was in contact with her, with first getting in contact with her. And I was just like, I just want to help you. Like, I want to help you, but I don't even understand the system. I don't understand who you're talking to. Like, and some notes, like, Nora was quite like digital also back then. So I could get access to quite like some of the people she was in contact with. But I could not see social workers' notes, and I could also not see psychologists' notes, who she was also like deeply involved with. I understand I shouldn't see everything, but at least like have the name or understand the flows. Like, you know, understand a bit. But there was also not an easy way for me to kind of get people together. So like, how are we going to support her? Because I can have these conversations with her, but that in itself is not going to help her at all. Like, you know, like that's not the thing that's challenging to her. It's like, we need to talk together, being a team together, but we didn't have that. We were not a team. We were different people working in the same hospital, but I never seen them before. I don't know who she was in contact with. And I think many times we're like looking at it from very much from like a clinician point of view, but we're not looking at it from a patient point of view and how they're going through it. And also thinking about some time back, I think last year, I went to the doctor with my son. He had a rash, or two different rashes on his back. And well, I didn't have with my insurance, we don't have a digital health app that I can just like use to diagnose or figure out, okay, what's wrong with my kid. And I just thought, okay, well, I would have to go to the doctor because I would probably need something on prescription, so I'd have to take my son to the doctor. So I go to the doctor and I sit there for 45 minutes because I didn't know I was there. That's also one like error, I think.
Issues that make accessing care so challenging, isn't it?
Yeah. And I could call in and go there, like there was no problem. But he had to take him out of school. I could not be working. And then we come in, and the doctor takes a look at him like 2 minutes, like, oh yeah, that's for this, that's for that. You just go to like the normal like Boots or whatever, you know, the store, and you just buy it off the counter. And I'm like, just after I'm thinking like, man, can we not like I'm not even the patient here, but like as someone who needs to go to the doctor, I don't like to go to the doctor. The doctor doesn't even need to see me. Why do we need to go to the doctor? That was not necessary. And like maybe someone else had to wait longer just because I had to make sure what type of cream to use. And it's stupid.
Yeah. Absolutely. I mean, I think the summary of that is you are not your condition. When you met that patient, and in your mind you thought you are not diabetes, you are not the condition you have, you are a whole person. And sometimes healthcare workflows are iterating or reiterating illness-based models, illness-based care, actually. And really what we're trying to move to is multidisciplinary, proactive, preventative, wellness-based healthcare. And that's hopefully where the future will go. Certainly that's my hope as well. So really relevant points you brought up around when a patient has specific or very different elements of their care and bringing that together, and workflows don't necessarily always reflect that, as well as, then logistical or just cultural things in healthcare, like you mentioned. Oh, you have to go and see a doctor before you do this. Actually, that could be streamlined with technology now, with AI as well. Where you are consulting a healthcare professional, but in a much more efficient way in our very busy lives.
Yeah.
You mind if I cut in with a couple of questions?
Yes, please do. And glad to see that the audience is providing questions. Great, keep that coming in. We want to hear from you.
And, first one's from Daniel. I believe he's the founder of My Tomorrow. If you want AI to support workflows in the long run, do you always need enterprise-grade solutions? And I think this is a debate people are having. I think, and I won't go into it. Or is it acceptable? That's an interesting choice. Or is it acceptable to rely on smaller one-off AI tools that get integrated into the workflow and keep running long-term? This is actually a deceptively complicated question.
Yeah.
Isn't it? It's actually like, and I did a webinar about what's beyond EHRs. We went for 2 hours and we barely scratched the surface of this.
Yeah.
But Ekanjali, do you want to take the first crack at that?
Yeah.
I'm taking over the host. I'm taking over the host from you. Get off. Sorry, I'm used to doing this.
Why not? Why not? No, absolutely wonderful question. And I think always need enterprise grade solutions. No, I think always is a very dangerous word. But I think it's a complicated one because depending on the infrastructure of the smaller solution you might be looking at, there needs to be an awareness of really the size and the power that that specific solution needs to be able to fulfill the various functions in a really large enterprise, and that can range from sort of national issues which you would look to solve, as well as small clinics within that infrastructure and how you can incorporate that. So really there needs to be the ability to support in that way. On the other, so that's my sort of cynical side. On the other end, actually, the amount of creativity that you can have as an enterprise when you're working with a smaller vendor is actually, can we use you to really look at our pathways? You develop your product specific to us. You're really serving our specific needs, and co-developing and working on pathways around that. So I can see both sides of the coin, and ultimately I won't be able to answer that wholly, but perhaps for the next webinar, as you say, Jose.
Can I have a comment on that? Yeah.
We all want to answer.
No, so I come from a startup world, and I would 100% like, okay, no, you don't need enterprise solutions for everything or always. I think what also, Ekanjali, what you said, like the creativity you can have, and if you look at where innovative solutions come from, they often come from smaller companies where they have the freedom, they can experiment, they can try. Enterprises, they work slow. I've also worked with bigger organizations, and they work slow, and they don't always look at new solutions and new innovative ways. But what I think is important, whether you use small one-off tools, is how well it's integrated. And you do mention it, how well it's integrated into the workflow. So I do think you need to have it integrated, because I think I heard once that there's 50 diseases in the eye or something like this. So if every disease needs one AI tool, well, you're not just going to be overwhelmed as a physician. So it needs to be integrated in one platform to choose, okay, what are you looking for? What are you looking at? So it needs to be integrated in the same workflow, not that you need to open 50 different tabs to go into and check what type of disease a person can have. So yeah, I think my personal opinion is that smaller companies can really, they are the ones who are innovating. I don't see a lot of interesting innovations with big enterprise. I see them copying a lot. I see them implementing a lot. I see them buying a lot, but I don't see them really developing and figuring out, first coming up with the idea.
Yeah.
So I think you need.
Sorry, finish.
No, continue.
No, I think understanding that an enterprise isn't going to have the same appetite for risk as you. So being able to address risk and safety concerns with with absolute strength, like enterprise solutions would. But then the value offering is around, actually, do you want to do it this way? Or do we want to look at how you can improve your efficiency? Or is this just what's worked for the last 20 years and you're now continuing? Do you want to have a look at how we could reimagine that with you? And you might have an appetite to do that. So positioning it that way would perhaps be valuable.
Can I say
Yeah,
something?
just looking at the Jose.
I'm being annoying. I interviewed a medical director in the United States, and he's a community oncologist. And there's a space he calls choose your own adventure, which is where like the startups are kind of innovating on the fringes, which is high risk for startups. But it's like the clinicians know, okay, we have to go to choose your own adventure land and try out these solutions. So it's high risk for the startups. But what I've noticed is startups who go into choose your own adventure land, it's not just hit or miss on that use case. They go into choose your own adventure land and they could fail, but they could also find 3 other use cases that nobody would have thought of unless they took a risk on venturing in to choose your own adventure land. So yeah, startups can take risks that other people can't. So I'll shut up now. I got more questions. Do you want to keep? Yes. We got a couple more questions.
No, let's take it from the audience. Why not?
Let's have a go. It'd be really. And I had him on that webinar I mentioned about platform shifts. He was one of the speakers. Would you agree that workflow is the answer to replacing a manual process, where AI can provide reasoning, which can elevate workflows?
Right. Well, I tell you, I'm going to start with that one again. What about AI that provides reasoning which doesn't elevate workflows would be my initial concern. So when we look at AI, I'm guessing AI enhanced workflows is what you meant, replacing manual processes. Absolutely. I mean, there's huge opportunity there in healthcare. Healthcare is still so analog, despite us being on digital EHRs. Or many, I think the US is ahead in that game, as well as many other countries. But certainly here in the UK, we're finally getting digital, but still a lot of the processes are click, 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 manual. So absolutely, you can improve that significantly. My concern is when we start to bring in reasoning. Now, I'm not saying that there is not a space for agentic AI in healthcare, but I think we must tread with caution when we ask AI to reason in certain environments at this early stage of its development. So being a doctor and a physician by background, I know how nuanced decisions can be. And you often want patients involved in that process, really their choice involved, a dialogue. It's not so algorithmic as people might think, not in every healthcare setting anyway. So that would be my word of caution on that. But huge efficiency gains still to be made.
We've got somebody.
What are your thoughts on that? Sorry, Jose, I'm going to get Sigrid's opinion on that.
Yeah, what to say? I kind of want to say, like, first of all, I want to look at the current workflow. Like, is that the workflow that needs to be done right now, and just like copy paste it and just like make it digital, make it like with AI. And of course, if AI can make it efficient, and I'm kind of a bit like sick of seeing the same workflows over and over again. We've seen the same with EHRs. Oh, you wrote it first with paper. Now you're just like, oh, I'm going to do it more, make it more efficient. And I'm going to write it on the computer. And has it really become more efficient? Probably not, because now we actually need to click before you had your paper on, probably with you. So, or next to the patient. But of course, like AI can really improve some of these workflows, whether reasoning is always necessary. Like, as you mentioned, Ekanjali, we don't always know why we make a specific decision. We don't always know the reason behind it. And it's like physicians, clinicians, whoever you are, like you can't always explain a decision you've made. And then having AI to explain something when people cannot even explain it. And then they can come up, I think we've all gone to ChatGPT or another LLM, and ask them a question like, that's like, that makes sense, like your arguments, like your the reasoning behind it. But then when you start digging deeper, like, actually that does not make sense, but
Yeah.
you tell it to me very convincingly, and you impact the way I'm thinking because I listen to you, because I do, oh yeah, you convinced me to kind of follow your path. And I think that is scary if you
Yeah.
implement AI with reasoning without caution in healthcare, any other places as well, but especially in healthcare.
Yeah, no, thank you so much, Sigrid, particularly for taking some of our questions as well, and having a really interesting discussion with me. So thank you so much.
Thank you.
I now have the pleasure of introducing our next speaker, Anastasiya, who joins us from Helsinki. So welcome, Anastasiya. Already introduced you to the audience, but I'd love you to do that again and explain your background and your lens in this discussion. So really what your experience around health AI has been and workflows.
Hey, thank you so much for inviting, and a pleasure to be here. Wonderful. So yeah, my name is Anastasiya Markvarde, and I work as an independent healthcare innovation consultant with quite a bit of a focus on women's health. And my background is in developing innovation, so innovative strategies for pharma, but also helping startups in the area grow. So supporting healthcare startups with acceleration programs. And especially for the next couple of years, I've been focusing on women's health as a hugely underserved area. And well, coming to AI, obviously, most of the startups nowadays use AI, and I think women's health is a particularly illustrative segment of healthcare that can show us how AI can and actually cannot be used. So I don't know. I have a very interesting example about that, and this is a quite a well-known case. So maybe some of you have heard of it, but I think it's so relevant to the topic that I might repeat it. Back in 2015, there was a study run by the University of California, Davis, and University of Iowa, and the researchers, they recruited 16 testers to actually be trained and distinguish breast cancer from microscopy slides and mammograms. So they didn't have any healthcare background, but basically from in just 13, 15 days, their efficiency of detecting breast cancer from the slides after the training from researchers increased from just 50% to actually a very staggering figure of 85%. And if you would combine the efficacy of like 4 testers, it would reach 99%, which is actually comparable to a pathologist, trained pathologist who is able to detect breast cancer. And why is this so relevant for AI? Well, maybe because I forgot to tell you that those testers were actually pigeons. So yeah, this is a real study.
I like how you kept that till the end, Anastasia.
This is a real study. You can check it out online. And this all happened in 2015, but now with the whole AI wave, why is it so relevant? So first of all, it shows us that when we have good data and consistent data, even a pigeon can be trained to really diagnose breast cancer from images. And actually, researchers made sure that they didn't barely memorize the images, but they actually were able to distinguish breast cancer even from new images. And sometimes we think that, you know, on one side, human is always needed. On the other side, if we're able to train pigeons to detect breast cancer, then we for sure are able to train AI models to detect brain cancer. Having said that, of course, we need to look further into the study. And actually, when pigeons were presented with detecting masses in breast tissue, they were really inefficient. So they couldn't get past, like, I think 50% of efficacy, which again shows us something for AI model training, which means that if you need like more factors for a diagnose and you can't just do it visually, you definitely need a human factor in there.
Yeah.
So yeah, I think it's a very curious case that illustrates like the way how we can train and how we cannot train the models probably.
Wonderful, a really interesting lens to that. Obviously, we hear about the capacity AI has in diagnostics, but the way you positioned it there is really quite compelling. So women's health, I mean, that's one area that really sparked this dialogue for me as well, where perhaps the way that we traditionally treat women's health, or it's taught in healthcare, is based upon a few conditions. And again, with AI and the capacity to look further into research and conditions that disproportionately affect women, things like dementia, things like heart disease, where we are actually underserving women because we don't have the backbone of research. This is one area where AI is really interesting to me, because the capacity for research there directly might influence the way we treat conditions that disproportionately affect women and have been underserved and under-researched as well. So in terms of the landscape, you've consulted with startups, worked with governmental organizations, VCs, etc. And particularly in this area, where do you see the future, and how do you see the way we treat women's health and healthcare changing and transforming?
Yeah, thanks for this question. I think, again, it's a two-way thing. So first of all, there are studies already confirming that AI can be indeed very helpful with adjusting existing diagnostic. For example, if we're talking about diagnostic to women. So for example, there was a study confirming that when the standard ECG is adjusted for female heart patterns, which are very different from male heart patterns, and many times heart attacks in women go undiagnosed because of that, it actually yields much better results. So I definitely think that that's the way to go. On the other side, it's again very illustrative case in terms of biases. So very straightforward reason for that. AI is trained on data. We have much more data on men than on women. And we have a lot of bias, unfortunately, still in our research papers. So that all feeds into AI models. And for example, there was a study from last year that confirmed, I think it was from the London Economics School, that confirmed that the models that are already in use now even rephrase patient cases very differently based on whether it is a woman or a man. So they literally fed them the same files, just changing it, for example, from Mr. Brown to Mrs. Brown. And AI was summarizing one case as Mr. Brown, who is incapacitated and needs help and support, and Mrs. Brown with absolutely the same profile as someone who has certain difficulties but is still independent and can take care of herself. Which shows us really clearly that there is so much work to do in order to avoid that influence coming into clinical practice. The same happened in a similar study that was assessing current AI algorithms and cases where a psychiatric condition was added to a file of a patient. And at first, models were performing really well. It was a study about cardiac disease risk. It was showing that the risk was equal, for example, in equal cases. But then when a psychiatric condition was added, it suddenly started saying that women were not at risk anymore. So again, there are so many factors in that that we need to consider. And I think the future is in going very cautiously and testing and piloting these technologies until we're really sure that they perform equally well for men and women. And again, of course, I'm taking women's health as just one area of an example. I'm pretty sure that there is the same biases, for example, in favor of white people compared to other ethnicities.
Yes, yeah, no, that's so well said, actually, in terms of, yes, technology offers huge hope, but the bias in the system, I wonder if that's a reflection of, you know, what it's being trained on. So the way the models are being trained with the data that we have, the way that we're treating, it's consuming that material to potentially lead to the bias. Have you looked into, you know, how that bias develops? Is that based upon historical data information? And how do we mitigate for that? How do we solve for that?
Yeah, I'm also quite sure that the bias actually comes from existing data and papers. And in fact, if we don't even talk about AI, but about like bias in research papers, there's been studies summarizing findings from the bulk of research that we have. And they were saying that men are usually described as stoic and brave. And in similar conditions, women are described as emotional or hysterical. So that's unfortunately very true. And that's something that really keeps affecting the algorithms. And well, I think we need more data. And that's why there are fortunately so many companies appearing in the space that are helping to collect data from women and help to incorporate this data into our databases and clinical practice. And I think we need more awareness as well in general about those differences. So many people still think that I don't know, women's health is about just women's rights, which of course it is, but then fundamentally is about offering better care for women and not missing another heart attack or not missing another Alzheimer in the first place.
Of course, and like better care for women is better care for everyone. You know, it has a domino effect on the entire family, the entire unit that they might be at the center of. So yeah, no, very important. So Anastasiya, in terms of when you're innovating with clients that you've worked with and looking at how you innovate, particularly when you're starting with workflows. And Brian, I see your comment, I really like it, where you actually do need to look at workflows and perhaps, as Brian suggests in the chat, pathway is a better way of thinking about it. Like, where is this patient journey going to be? Patient-centric systems in the words of Brian Greene. So when you're innovating in that space and looking at how you are going to solve in those patient-centric systems, how do you go about it, or how do you advise your clients to go about that?
Yeah, I think it's like another layer that we're adding on top of anything else that we need to take care of when we're starting to build a product. So for example, I don't know, maybe a bit of a rough example, but in general, if we go back in time and just a few companies really cared much about data privacy before, you know, all this other regulations took place, and before we started to understand that, okay, before you even start building the product or in the very early stage, you need to take care about data privacy, you need to incorporate security algorithms, you need to comply with either HIPAA, GDPR, or any other regulations. And actually, while running acceleration programs, I noticed that this started to be very obvious to startup founders. So we kept talking about it. Unfortunately, we learned by some cases that were not very good in terms of sharing the data with third parties, but that's how the industry was as well. So I think biases in AI would follow the same path. Basically, first the technology explodes and everyone rushes towards building an AI algorithm, not thinking much about things like privacy or biases. But then, of course, once the technology is crystallized and it moves towards something more organized, we just, I hope, I really hope we will start thinking of those biases as just one more checkpoint that we need to think of.
Yeah.
So yeah.
So what advice would you give to people that you work with in terms of bridging a hospital actually adopting, or an enterprise actually adopting this solution versus actually you solving for that problem? Like, there's often a mismatch or a bridge to be crossed there. And how would you do you have any advice around how one would go about that?
Well, I couldn't probably miss mentioning and diversity in terms of any kind of diversity. So either you need to look whether women are using your product more, or whether it's based on, ethnicity or any other parameters. But I think it's so important, and of course much more beyond just nice speeches and so on. But it's super important in terms of avoiding biases and actually making it work with your product. Because if we're talking about women's health, it's 50% of the population, and probably you're just ignoring them, right? So the same would apply to other groups. And again, I think pretty much we are working at the moment on a male standard in the industry, which historically shaped like this, and which was the easiest one to go with. But we can no longer afford that. So I think from the very early stage, we need to think really a lot about diversity. And again, many times I talk to startups and they think, okay, but we work in cardiovascular, for example, we're not a gynecologist startup. Why should we think so much about women? Well, then we start looking into the facts and how much it could actually affect their performance. Talking about like policy level decisions, it's absolutely the same. For example, it's quite known by now that most of DIGA users are women. For example, in Germany, if we're talking about reimbursement pathways for digital health solutions. So again, if you're not looking into that, you're ignoring your customers.
Yeah. Where is the biggest resistance you found? You've worked in women's health for a while, and whilst the landscape is changing, we see more and more about this. Where is the most resistance you've encountered around that? So you're trying to really address a workflow, an underserved workflow of the way that women's health has been traditionally treated, potentially. Where have you found the most resistance, most bottlenecks, the biggest challenges?
I think it's still very hard for many in the industry to understand maybe the extent of the problem. So I think that the first thought of many, or first reaction, is like that is some controversial topic and women are just talking about it because they want attention, or because they want to talk about women's rights and just be visible. But in fact, it's such a fundamental problem, such a fundamental issue that affects everyone's health, and that leads just to premature deaths and years spent in poor health, that again, it will take a while probably to really convey this message to the decision makers and to healthcare professionals and to everyone working in the industry. But we're trying to work on that.
Yeah, no, absolutely. You're trying to change the cursor, as we say. So Jose, I'd love to bring Sigrid back on and have you both here at this stage, and actually get both of you perhaps talking on this in terms of the future and really what that looks like. So we've said, or at least the statement I posed to you both when you were invited to come to this webinar was workflow is not enough. So if workflow is not enough, and AI is transforming the landscape, then what does the future look like over the next couple of years? What are your hopes for the healthcare landscape, and what are your predictions around that? And I'd love to sort of get both of your opinion on that, and perhaps Jose as well, who joins us too. So I'll start with Sigrid. What are your thoughts on that, Sigrid?
So yeah, I really hope that the workflow is not enough, and that we try to re-look, like what I mentioned before, like look at the flows from a patient perspective. What is needed, like where do they need to go? And again, we don't always need to physically see a healthcare professional. I think a lot can be done with technology. Of course, not everything. And I'm not saying that AI will take over doctors or nurses' jobs. Some tasks, yes, and perhaps some jobs even, but there's so much work out there still in healthcare, so that's not something I would be afraid of. But I would also like to see healthcare reimagine. Was it Brian who said that, like that word reimagine? And I would like to see that, because like I've been in Conqual talks or like listened to talks where people talk about like the hospital of the future, and I'm like, you're not seeing that vision. Like it's just, oh, well, you know, like we'll have like robots getting the medicine for us, so they're like in the hospital, and like, but you're still in the hospital, or you might have hospital at home. But I think we need to think further. We need to think at what also can be automated. Not yet. We're not there yet.
Yeah.
But for example, okay, you have an app on your phone, and you take a photo on your skin and get like you see, oh, I have cancer, I have this or that, and it automatically brings you to the next step. It's not like you don't need to go to the doctor to get the next step. Maybe the doctor will look at that image to kind of confirm, yes, I do agree, but it will take you to the next step and maybe already kind of book those meetings with you. But things need to be seamless, because right now it's the clinician who's the middleman, like between the next clinician is, and you always need to go back and forth, back and forth, back and forth. And that's, I think, what we need to reimagine, because a lot of these conversations that we have with the middlemen is also not useful. It's taking time from patients.
Thank you, Sigrid. And Anastasia, the same question for you. So, you know, the future, where are you hoping it will go? What are your predictions around that in terms of as workflows change, as technology advances, where do you see the cursor going?
I really hope we're going towards validating all those solutions that we have created and towards adopting them in a meaningful way, because we have an explosion of technologies, which is great. We have all kinds of technology to track anything, to record all your data. We are finally moving towards new segments, for example, even hormone tracking currently, and we're having more and more wearables or more and more at-home tests available to detect any kind of things, and including the market is full with kind of full body diagnostic solutions and anything else like blood test panels, for example, that I see really exploding. What would make a lot of sense, of course, is to bridge those solutions with our healthcare system, to integrate them, but then also do it in a meaningful way, in that we use the innovation when it's needed, and then of course we make it work in terms of getting this data available for our clinicians. Again, there is a big problem of kind of dumping your data onto a clinician when you're showing them, I don't know, 5 years from your Oura ring. And of course, that's not something that a person could look through in a 15 minutes visit and analyze it. So I think we probably need some more technology somewhere, but in a bulk of it, we have really a lot. And what we need is to validate it and to find a way to reimburse it in our healthcare system, integrate it, and make it work together with clinicians.
Yeah, absolutely. Yeah, really make it operational as opposed to just theoretical, really. And Jose, yourself as well. I mean, you're an expert in this area. You've worked with clients across the landscape, you know, from early stage startup to enterprise grade as well. So what is your narrative, or what is your perspective on this in terms of the future? Where do you see that going when things are changing so rapidly? And so it can even feel like, for me, hard to keep up.
Channel something Phil said, and this is not overarching. He's in the audience. And AI doesn't have to be real time. So right now, a lot of it is somebody, a clinician, or is accessing a chat interface. That's not the only way to use technology. It could be deployed asynchronously, like WhatsApp, like a WhatsApp message. You send somebody a WhatsApp message, you're not having to answer it right away. The LLM could be behind a human being, doing something asynchronously, and the work product is accessed at the point of need by a human expert.
Yeah.
And the clinician or the patient is on the other side of that. People call it human in the loop, but I don't actually like that. But this requires a totally reimagined workflow.
Yeah.
You have to actually the chat interface. You can just throw it at people. You can just throw chat interfaces at everybody. If you actually want to put an LLM behind some other expert who's not current. It's a lot harder. It's a lot more niche.
Mhm.
We're going to see a lot of older founders, people over 50, people close to retirement age that are like, oh, we've always wished it was somebody who would like to do this, and it'd be very niche. And we're going to see more of that.
Yeah.
And, I know Phil's been posting about this, and he's been talking about it. I had him on a webinar a couple months ago. We're going to see more of that. It's hard to describe in the abstract. You can see examples, and it's, oh, okay, yeah. But it's hard to do. It tends to be more niche. It tends to be more expensive, and it doesn't get rid of it. You have to hire people, and I think the people who do that, you'll see startups that are like 90% healthcare experts and one engineer.
Yeah.
And it's coming. It's just going to be slower.
Absolutely.
But that's not everything. Obviously, that we're going to see that.
Yeah. Yeah, no, I agree. I mean, from my perspective, certainly I'm sure we all share this view. I really hope that the patient continues to be more and more at the center of their care. And their care isn't just about the medicine that they receive or the doctor that they see, or I guess the AI agent that they might see before that. But really, the experience they have of being unwell and well, and really how we can serve them better going forward. And with AI, we really have an opportunity to say, hey, should that process be happening? I mean, Sigrid, you spoke to this at the beginning, where workflows have actually limited your ability to serve the patients that you wanted to. And you gave us that wonderful example of the malnutrition patient that you weren't able to necessarily see in the same way. I think my takeaway from our discussion was the patient is not their disease, and sometimes workflows emphasize that perhaps more than they need to. We're not thinking more broadly about care, and we're not necessarily empowered to do that in our current structures. And Anastasiya, really enjoyed your perspective on women's health and the importance of really solid data there to back really innovative solutions that potentially challenge the way that we've traditionally treated patients as well, and the dialogue there. So I really want to thank you both for your time, and Jose, of course, for setting up this wonderful webinar. To the audience as well, thank you for your questions and your engagement. We'd love to pick up the conversation with you afterwards as well. So do keep the questions coming to myself and members of the panel as well. So thank you, and see you next time.